Every day is different as a veterinarian. Some good, some calmer than others, some dramatic, and even sad at times. Every patient that goes home with their family or whose suffering I can help is another reminder of why I do what I do. I am DocBot.
Last time on DocBot, DocBot removed a cancerous spleen from Loki, a large mammary tumor from Georgia, and happy puppy news for another of his patients.
I'm going to cough up a hairball in 2 minutes here. By golly. Is it just...
Carmel was brought in for leg pain, reacting to touch and biting when his owners would attempt to pick Carmel up.
Ooh, you are stressed. Those are some dilated pupils. Look, I've been here before. You gave me a shot and I fell asleep, huh? Do you remember that, sweetie? Okay. Okay, I'm just going to feel these back legs. First thing I'm going to feel for, I'm going to look at the knees, the kneecaps. Luxating patellas, or loose kneecaps that pop in and out of place, are kind of common in this breed. Situations like this, it's best to take x-rays and just see what's going on. A loose kneecap is pretty common. I'm going to show you kind of some pictures of what we're looking at right here, okay? And basically all that's happening is that groove that kneecap sits inside of, at the end of the femur, one is either too shallow, or two, the attachment of the patella tendon to the tibial tuberosity right here is off to the side and not straight like it should be. On her, it feels like it might just be more of a groove issue, where that groove might not be as deep as it should be. That being said, though, I cannot luxate that or pop that kneecap out all the way, but there still is some movement. And that tendon with that kneecap inside, when it moves, there's a meniscus is what this is called. It's kind of like a pad inside of the joint. And that's very, very sensitive. And so if that kneecap is tweaked at all, we're really, really susceptible to, it's just going to be painful.
Yeah.
And so I think that response you're seeing is probably because she's just guarding that leg. And she knows that there's something wrong with it and she doesn't want it messed with. So the right side is the left side feels really, really tight. So an x-ray will tell us, is there anything else going on there? I can look at the hips and the knees at the same time. That's going to be the most comprehensive assessment. If you can't do the x-rays today, then we can do just some anti-inflammatories. A lot of dogs have loose kneecaps, luxating patellas.
If you notice your dog acting strange, like guarding their hind end or sitting funny, or strange aggression when handled, this could be a sign of arthritis or injury. Carmel has loose kneecaps, a condition fairly common in dogs. We will treat Carmel with anti-inflammatories to reduce pain and swelling, and have Carmel come back in a couple of weeks.
Get those and we'll just give them as needed, and if that doesn't help, then we might just be going with a training issue. I think just from the popping that I feel, there's got to be some discomfort there. So.
There's no such thing as a quiet day at the office for Mountain West Animal Hospital.
So we do have a parvo puppy outside in the van outside right now. Parvo is a term we use that is short for parvovirus. And parvovirus is a virus that affects puppies, and it's a devastating virus. It attacks the intestines, little areas of the intestine that the cells that make what are called villi, the little projections that come out in the intestine that are responsible for absorption of food and nutrients. And parvovirus essentially wipes those out. And so puppies that get parvo will have horrible vomiting and diarrhea. Often it will be bloody, and it will stink incredibly bad. If you ever smelt diarrhea or vomit from a parvovirus puppy, it's a smell you will never forget. It's unmistakable. When you smell it, you know exactly what it is. So we have two treatment options when puppies come in. They're really, really sick. I always recommend hospitalization. We hospitalize and do intravenous fluids. Parvo puppies generally die from either dehydration or bacteria that enter their bloodstream from the intestines. So we treat aggressively with antibiotics, control the nausea, keep them hydrated, and they generally will go through. 70–80% of the pups that we see live through Parvo. This owner elected to do an at-home treatment, so she is actually administering antibiotics and everything and doing fluids at home. And we are having some pretty serious nausea today, which is to be expected. For 3 to 5 days after parvovirus hits, you do see vomiting. And so we're going to give an injection right now to control that nausea, hopefully stop the vomiting. We're going to send a couple of shots actually for her to give at home. So I'm going to, number one, give a shot right now and then teach her how to give an injection. I think she's a little bit nervous about it, but I'm sure she'll do fine. And she'll have to be 1 injection each day for the next 2 days. Oral medications are really handy also to control this nausea, but if we're throwing up and you give a pill, when you throw the pill up, the pill did no good. So giving these shots is going to be more effective, I think, and help us control this.
Yeah.
Okay. So you have 2 of these at home.
Okay.
Parvo is so highly contagious that one infected animal can shut down the entire clinic to sterilize the entire office before pets can be seen again.
So it just has to go under the skin. The easiest place is going to be right here underneath the skin.
Okay, right between the shoulder blades, basically.
So we do have a Parvo puppy outside in the van outside right now.
Okay, right between the shoulder blades, basically.
Just pull that up right there.
Oh, he's already mad. He knows.
I just stick it right underneath there.
Oh, okay.
Oh, I'm so sorry. Hey, pup, you're going to be okay. Whack that.
He's a very pouty dog, too, so he's going to go home and cry about this.
So having really good color like this, I think we're going to be okay. Just continue with what you're doing, and then tomorrow, 24 hours from now, give the next shot, and then 24 hours again, give that second shot. If there's issues, let me know. I'm here from 9 till 1 tomorrow.
Okay.
When you do anything else,
Okay.
just call me.
All right.
Watch for, blood and vomit. If that starts to happen, just give me a heads up.
Okay, and then, will this help with him maybe trying to get his appetite back?
Definitely.
Okay, because when you gave him the shot the other day, he was fine. Like, we got him home, he started eating, he started playing.
Parvovirus is a highly contagious and often deadly disease for puppies and dogs. If your puppy or dog loses their appetite, has severe bloody diarrhea, lethargy, anorexia, fever, vomiting, or severe weight loss, take your pet immediately to the nearest vet. Do not take your pet inside, and alert the front desk that your pet has these symptoms. Parvovirus can be treated and even prevented with early vaccination.
That kind of seems like. Okay, cool. All right, thank you.
Bye-bye.
I'll be right back.
How are you today? Good. She's about 2 years old, is that correct? Okay. And this is her first pregnancy, correct? If she is pregnant.
DocBot gets excited for puppy news when he sees a dark spot, which could be a puppy on the ultrasound, but on further exam realizes our mama-to-be simply has constipation.
Okay, Scout, there we go. I'm just going to kind of gently palpate the abdomen here and just see if I can feel anything. Definitely pregnant.
Yeah?
Yep, I can feel one for sure.
I felt something.
Yeah. Yep, I can feel. We'll just do an ultrasound to see if we can count. An ultrasound's more of a fetal assessment. Look at heart rate and just make sure everything looks normal. And then I always recommend that we do an x-ray later in gestation to count and make sure that size-wise we're okay. Okay, we're gonna go on our back here. We'll test her patience a little bit. You're a sweetheart of a dog, I can tell though.
Very sweet.
A little bit cold, sorry.
That feels really weird, huh?
Not able to see a whole lot with this. Probably why this switch to my own one. Okay, so right there you have one. Little black spot. We're going to switch to a different ultrasound probe now. I think we'll be able to see a lot better. Just a minute. Okay, so these little spots right here, they're gonna be little black dots right here, and that's our puppies. I'm gonna try to zoom in a little bit here. I'm just not getting real good contact here for some reason. It's just not a real good image quality.
This is why it's good to get an ultrasound and not just feel your pet's abdomen at home. Even veterinarians can make a mistake sometimes. We are all human.
Might have actually been feces that I felt in there. I'm just not seeing what we need to see here with these. So this is the black spot right there is the bladder. See that? That round circle right there. The uterus is right underneath that. So as we come forward right here, I'd expect right there to see more. And they're almost perfectly black spheres that will have just a little embryo inside, and you'll be able to see the heart rate and everything. But I am not seeing that. Okay, so for her, I want to redo this in a week. I won't charge you to redo it. But I do not see a pregnancy. And so I just want to make sure, though, that everything's okay. There is a tiny, tiny bit of fluid right there in the uterus, but that's it. So, does that sound okay?
Mm-hmm.
Unfortunately, it does not look like we have one. I don't know if I just felt like a piece of feces in the colon, or I felt that. I swear I could feel a little round. Okay, let's plan on checking her again in a week. You live close by. Hopefully that's not going to be too inconvenient for you. Have a little bit of a sticky abdomen. Sorry. Okay. We'll put her right back down on the ground. We actually just looked at Scout just a little bit ago and did a pregnancy ultrasound. When I initially looked at Scout, I palpated her abdomen and I thought I could feel actually a small fetus. At 30 days, on a dog her size, the pregnancy is about that big, almost the size of a golf ball. And so I thought I could feel that. But when I used the ultrasound and actually looked, there was not a pregnancy. And that just shows how important it is that you cannot just go from an abdominal palpation or just feel your dog's belly and assume that they're pregnant because you feel something. An ultrasound is really the gold standard for determining pregnancy. And when I looked, everything was normal. I assume I just actually grabbed the colon and there was a little bit of feces that I had felt, but it just kind of shows that even veterinarians, sometimes we think we see something or feel something, and then when we do the testing, it isn't quite so. But that's just life, and that's kind of how the everyday rigors of being a veterinarian kind of play out. It's kind of an emotional roller coaster every single day.
One of DocBott's main veterinary focuses is genetic research on animals, especially reindeer, deer, sheep, and mountain goats. His own herd are not just for genetic research, but his own overgrown pets.
Reindeer have a very pronounced dew claw back here compared to other deer species. It's a lot longer.
These actually will click, and the tendon inside the feet when reindeer walk clicks. It's very distinctive. And you hear the lyrics to the song up on the housetop. And click, click, click. It's because that actually does happen when a reindeer walks. And the clicking is thought to occur so that reindeer in incredible snowstorms, when there's a whiteout, they can actually follow each other and hear each other just from that sound. So long as Sven's eating, he'll let me brush him out. Reindeer can have up to 3,000 to 5,000 hairs per square inch on their body. And as you saw last time you were here, how thick their hair was that was coming out. Reindeer hair is hollow. Reindeer's favorite time of year seems to be in January. This July and August weather is not their favorite time. They can't sweat, and so they pant if they get too hot, or they will stand in the water. But up in Alaska, also this time of year, it's the same thing. They just graze, and during the summer they put on as much weight as they can, and they predominantly are eating grass, and there's about 31 species of plants that we know that they really like to eat. My reindeer here are on a grain ration. They each are eating between 7 and 9 pounds per day this time of year. So they build up their fat reserves, so during the winter they don't eat nearly as much as they do during the summer. In the wild, reindeer switch from grazing to being a browser during the winter, and they eat just basically lichen. Saying hi there, Titus?
Titus is currently alpha and DocBott's main pal in the herd. When rutting season begins, DocBot wears a bulletproof vest, as reindeer are particularly feisty when in season, as they normally would be competing for mates in the wild. Reindeer and all wild animals have extremely sensitive digestions, and the wrong food can harm them. Never feed an animal you are not familiar with in the wild or at the zoo.
My first reindeer experience happened on March 28th, 2010. I was driving down I-15 here in Utah, and a guy called me and said, "Hey, I got your name from a buddy of mine, and he says you do a lot of veterinary reproduction." And I said, "Yes, I do." And he said, "Well, I have a reindeer I think is pregnant. Will you come and look at her?" And at that point, I had been a veterinarian for about 10 months. I had never seen a reindeer in real life. I thought, well, you know, why not? I knew I liked elk and deer and stuff like that, but I thought, well, that will be a challenge. And I told him I hadn't had much work with them, and he said, "That's not a problem." He goes, "You know, we've had other vets that come out and we've been able to teach them." And he said, "I just need somebody that knows a little bit about reproduction." So I show up and we start working on this cow. And when I get over to her, she is actually in full-blown labor. And I said, "You know what? She's pregnant for sure." I'd never delivered a baby reindeer or anything. But I delivered lots and lots of sheep and alpacas and other species. So I thought, you know, we can do this. Sorry, Sven. A little sensitive, I know. Go, easy. There you go. Go on, take some more. I need to get you some apples. Did I just breach your comfort zone there? Now you're mad, aren't you? Oh. Stay back here. Come here. Come here. Hey, come here. Come here. Here, I'll get you some apples. Let me just grab him a couple of apple treats real quick and he'll be good.
Disguising dewormer medication in apple treats is much easier than wrestling a reindeer. DocBot regularly clips their hooves, which would normally wear down on rocks in the wild, and starts the laborious process of brushing out their old winter coats.
Sven gets a little stressed, and the unique thing about this reindeer is if he gets too stressed, he will faint. And so when he starts to pull back like that, I stop immediately, and this is his favorite treat. And he'll calm down and be back to normal now. Want your apples? Here. There you go, partner. Come on. Let's pour them right there. Help yourself. You just got one toe left and then you're done. Now you gotta eat it now. I don't care. You gotta eat it. That's your medicine, partner. Here. Here. I'm done now. You can eat. I'll leave you alone. Oh, now you don't want it? Poor Sven. Now you get to go back. Go back with your buddies. Come on. Got a nice pedicure.